Every headache is not ordinary. Like every headache is not ordinary. So this idea of it is an ordinary headache, I want to discard it in this video so that you begin to understand and appreciate the fact that your brain is telling you there is a problem ongoing. Also, in this video, I'm going to discard this idea of the fact that it is typhoid. It's typhoid. This headache is due to typhoid or is due to malaria. No, there is something your brain is trying to tell you. That is why you're having headache. Now, headache itself is a symptom, meaning that it is pointing to something. Something is causing this headache. You understand? So, and every headache is not migraine. It is not vascular headache. There are other things that may possibly cause this headache in this individual. So with my few years, with my few months of practicing as a resident doctor in anesthesiology, I have seen a lot of patients, especially patients from neurosurgery, patients from neurology and patients from ophthalmology having headache, persistent headache. But the problem is that they did not present in time. So by the time they are presenting, they are already presenting with the complications from what is causing the headache. So the idea of this video is to make us to understand and appreciate the fact that if any of your relatives is having headache, tell the person to go to the hospital, because there are a lot of things that can cause this headache. It must not be due to malaria. You understand? Because most of them will be taking over-the-counter medications, for a long time. That headache might be there, like especially in this neurosurgical patient. Some of them will have headache for like 1 year, 6 months, 2 years sometimes, and they will not be presenting by the time they are now having paralysis, having difficulty in walking, becoming unconscious. You understand? So that is the idea of this video. So I want to welcome you once again to my YouTube channel. If this is your first time meeting, my name is Dr. Chidebere Eze, and on this channel we discuss about health issues, importance of exercising, and other present issues within our community. So I want to encourage you to help me share this video. Also remember to subscribe to my YouTube channel and turn on your notification button so that anytime I place any video, you'll be able to get my video. Thank you and you're welcome once again. Now, discussing about other things that can cause headache apart from malaria and typhoid. Now, one thing I want you to understand is that if you have malaria or typhoid, there will be other symptoms. They are called constitutional symptoms that person is going to be having. For instance, if you have something like malaria, for instance, you may be having fever. Apart from the headache itself, you'll be having chills and rigor, that is cold and rigor, weakness associated with it. You understand? So it's not likely going to be the headache coming from malaria that you're going to be having all the time, or from typhoid. If you're having something like that, you may be having something like diarrhea, abdominal discomfort, abdominal pain, and other things related like fever as well. You understand? So this idea it is coming from typhoid, it is coming from malaria. No, I want you to discard that and treat yourself. Find out what is causing this headache. Again, I want to also discard this idea it is coming from migraine, it is coming from vascular headache. No, there may be other things. You have to rule out other things, so you be sure that it is not due to something more complicated than what you are thinking. For instance, in neuro patient, some of them may have tumor. If somebody is having brain tumor, like as you're seeing on the screen, if there is a growth happening in the brain, one of the first symptoms the person is going to be having is headache. So it's a first symptom. It's a signal that the brain tells the person that there is something happening. You understand? In neuro patients, some of them will start having headache for 2 years, 1 year, 6 months. Before they will now present this, the tumor has already spread beyond the brain or even beyond the part that it has been growing. And so they'll start presenting with other complications as well. So I want to encourage you, if you're having headache, go to the hospital. That is number one. Number two, in some neurosurgical neurology patients, for instance, some of them may be hypertensive. Some people that have hypertension may present with headache, especially sudden headache, acute sudden headache that may be throbbing, like knocking the person, the person is having something like axe. They are trying to break wood in that person's head. You understand? That kind of headache may be due to hypertension. I want you to know that hypertension is a silent killer. So for hypertension to start causing headache, maybe a warning that there is what? Impending stroke. That stroke is on the way. Do you understand? So that is why the brain is telling you there is problem, so that you can go to the hospital and be attended to. So that you are having headache, you don't be at home. No, there is something happening. So number 2 is what? Hypertension. Number 1 was what? Tumor, brain tumor. Number 3 is people that have visual problem. For instance, people that have glaucoma, people that have short-sightedness, astigmatism may have headache because of visual problem. So if you are having headache, it is not just from malaria, it's not from migraine. No, go and check yourself, because the earlier the better. If you don't check yourself, for instance, if you have something like glaucoma, for instance, and you don't go to the hospital and check yourself and be checked by an ophthalmologist, you wouldn't know that glaucoma can actually cause retinopathy and cause damage of the eyes, and the person can go blind. So the idea of this video is to make you understand that the headache you are having all the time, especially after you have taken paracetamol and the headache is persisting, is that there is a problem. Kindly find out time to go to the hospital and treat yourself, and know what is causing the headache, and not be treating headache itself. Know what is causing that headache. That is the essence of this video. Please help me share this video so that other people can learn from this video and also go for treatment. Thank you so much.